Your medicine cabinet overflows with supplement bottles that promise better health and sustained energy every day. Yet your monthly supplement expenses keep climbing while you wonder if any of them actually work for you. Consequently, your body feels exactly the same, despite taking handfuls of pills every single morning without fail. Therefore, your supplement routine might be doing far less than you realize for your overall health and longevity. Your supplement spending could be wasting hundreds of dollars annually on scientifically unproven products that do nothing. However, your body may actually be harmed by certain popular supplements marketed specifically to older adults today. Consequently, your chances of taking a beneficial supplement drop to just 15% of available options after 60.
This video is for educational purposes only and does not replace professional medical advice from your doctor. After 60, certain nutritional gaps become biologically predictable based on how aging changes nutrient absorption rates. Therefore, vitamin B12 absorption declines as stomach acid production decreases, a normal part of getting older. Consequently, sun exposure drops, kidney conversion slows, and vitamin D status often falls below functional levels. Therefore, these are the gaps where supplementation has the clearest clinical rationale and the strongest evidence base.
Number 10. The multivitamin myth for adults over 60.
Large randomized trials have repeatedly failed to demonstrate any meaningful benefit from daily multivitamin use. The COSMOS trial, one of the largest supplement studies ever conducted, found multivitamins provided minimal protection. Yet many older adults still take them believing they fill nutritional gaps that diet alone cannot address properly. However, most deficiencies after 60 are specific to individual nutrients rather than broad vitamin and mineral coverage. Consequently, a general multivitamin cannot correct predictable ag-related absorption problems like B12 or vitamin D. Therefore, targeted single-nutrient supplements with proven clinical evidence are far more effective for older adults. But the supplement industry continues marketing multivitamins as essential despite the lack of robust trial data. Therefore, you should redirect your supplement budget toward evidence-based options rather than broad-spectrum multivitamin pills.
Number 9. High-dose antioxidants that may cause harm.
Antioxidant megadoses like high-dose vitamin E and beta-carotene have actually shown harm in some smoking populations. The SELEC trial found that high-dose vitamin E increased prostate cancer risk in healthy men over time significantly. Consequently, taking large amounts of antioxidants without medical supervision can disrupt your body's natural oxidative balance. Yet many supplement labels promote these ingredients as anti-aging despite the concerning clinical trial results from research. Therefore, you should avoid any supplement containing more than 400 international units of vitamin E daily. But beta-carotene supplements have been linked to increased lung cancer risk in smokers and former smokers alike. Consequently, the evidence clearly shows that more is not better when it comes to antioxidant supplementation for seniors. Therefore, stick to food sources of antioxidants like berries and vegetables rather than high-dose pills for safety.
Number 8. Collagen supplements for joint health.
Collagen supplements are broken down to amino acids during digestion before they ever reach joint cartilage directly. Therefore, your body cannot directly use ingested collagen to rebuild your joints or improve skin elasticity effectively. Yet many older adults spend significant money on collagen powders, hoping for pain relief and mobility improvement daily. However, the clinical evidence for collagen supplementation remains weak and inconsistent across well-designed human trials conducted. Consequently, your money would be better spent on protein-rich foods that provide all essential amino acids needed. But some small studies suggest collagen may improve skin hydration, though joint benefits remain unproven and uncertain. Therefore, do not rely on collagen supplements as a primary strategy for managing arthritis or joint discomfort symptoms. Instead, focus on strength training and adequate protein intake to support your musculoskeletal health after 60 years.
Number 7. Glucosamine and chondroitin for arthritis.
Most joint supplements like glucosamine have not outperformed placebo in well-designed randomized controlled clinical trials. A large GAT trial found no significant difference between glucosamine and placebo for knee osteoarthritis pain relief. Yet these supplements remain top sellers in pharmacies despite decades of conflicting and underwhelming clinical evidence. However, some patients report subjective improvement, which may be due to placebo effects rather than biological activity. Consequently, the American College of Rheumatology recommends against using glucosamine for osteoarthritis treatment in patients. Therefore, you should not expect glucosamine or chondroitin to reverse joint damage or provide reliable pain relief. But if you choose to try them, ensure you purchase pharmaceutical-grade products tested by independent laboratories for purity. Nevertheless, your best approach remains weight management, physical therapy, and anti-inflammatory medications prescribed by your doctor.
Number 6. Herbal testosterone boosters for men over 60.
Herbal testosterone boosters sold for men over 60 typically show no measurable effect on serum testosterone levels. Ingredients like Tribulus terrestris and fenugreek have failed to raise testosterone in rigorous placebo-controlled human trials. Yet marketing claims promise increased energy, muscle mass, and libido without any supporting clinical evidence whatsoever. Therefore, these supplements exploit the natural decline in testosterone that occurs with aging after 60 years. However, true testosterone deficiency requires proper medical diagnosis through blood tests and physician evaluation before treatment. Consequently, you should never rely on over-the-counter herbal products to treat suspected low testosterone symptoms alone. But some ingredients like ashwagandha may reduce cortisol, though testosterone effects remain minimal and inconsistent overall. Therefore, consult an endocrinologist if you have genuine concerns about your hormone levels after age 60 years.
Number 5. Memory supplements with proprietary blends.
Memory supplements containing proprietary blends rarely disclose dosages of their individual active ingredients to consumers. Therefore, you cannot verify whether you are receiving clinically effective amounts of any claimed beneficial compound. Yet many older adults purchase these products hoping to prevent cognitive decline or improve memory function significantly. However, ingredients like ginkgo biloba have failed to prevent dementia in large, long-term clinical trials conducted. The ginkgo evaluation of memory study found no reduction in dementia risk among older adults taking it daily. Consequently, proprietary blends allow manufacturers to hide ineffective doses while charging premium prices for hope. But some individual nutrients like omega-3 fatty acids do have evidence for cognitive health when taken properly. Therefore, avoid any supplement that lists a proprietary blend without specific milligram amounts for each ingredient listed.
Number 4. Weight loss supplements marketed to seniors.
Weight loss supplements marketed to seniors rarely produce sustainable fat loss beyond what placebo effects achieve alone. Ingredients like green tea extract and conjugated linoleic acid show minimal metabolic benefits in older adult populations, yet these products promise rapid results without diet changes or exercise, which is biologically implausible and dangerous. However, the FDA does not regulate weight loss supplements for safety or efficacy before they reach store shelves. Consequently, many contain hidden stimulants or undeclared pharmaceutical ingredients that can harm older hearts significantly. Therefore, you should never trust weight loss supplements that claim to bypass the need for calorie reduction entirely. But some fiber-based supplements like glucosamine may increase fullness when taken before meals with water consistently. Nevertheless, the only proven strategy for weight loss after 60 is caloric restriction combined with resistance training exercises.
Number 3. Immune-boosting supplements without evidence.
Immune-boosting supplements like echinacea and elderberry lack robust evidence for preventing infections in older adults. Yet these products are heavily marketed to seniors who worry about declining immune function with advancing age. However, vitamin D and zinc do have legitimate evidence for supporting immune health when taken at appropriate doses. But most commercial immune formulas contain multiple herbs in untested combinations that have never been studied properly. Therefore, you should focus on proven immune supports like adequate sleep, vaccination, and balanced nutrition instead. Consequently, the term immune boosting is not medically defined and allows manufacturers to make vague health claims. But probiotics for immune health show some promise, though strain-specific effects vary widely between different products available. Therefore, stick to vitamin D and zinc rather than expensive proprietary immune blends with no clinical trial data.
Number 2. The supplements you are probably wasting money on.
Multivitamins for adults over 60 have repeatedly failed to demonstrate benefit in large randomized trials conducted. The COSMOS trial, one of the largest supplement studies ever conducted, found multivitamins provided minimal protection only. Yet antioxidant megadoses like high-dose vitamin E and beta-carotene have actually shown harm in some smoking populations. The SELEC trial found that high-dose vitamin E increased prostate cancer risk in healthy men over time significantly. Consequently, collagen supplements are broken down to amino acids during digestion before they ever reach joint cartilage. Therefore, most joint supplements like glucosamine have not outperformed placebo in well-designed, randomized controlled trials. But herbal testosterone boosters sold for men over 60 typically show no measurable effect on serum testosterone levels. Consequently, memory supplements containing proprietary blends rarely disclose dosages, and their ingredients often lack clinical trials.
Number 1. The supplements with genuine evidence for adults over 60.
Vitamin D3 at 1,500 to 2,000 international units daily has strong evidence for fall prevention. Therefore, vitamin B12 is legitimately difficult to absorb after 60 due to declining stomach acid and intrinsic factor activity. Consequently, sublingual or methylcobalamin B12 bypasses the absorption problem and corrects deficiency reliably in older adults. But magnesium glycinate supports blood pressure, sleep quality, muscle function, and insulin sensitivity simultaneously for seniors. Therefore, most adults over 60 are below optimal magnesium levels, and dietary sources alone rarely correct this reliably. However, creatine monohydrate has strong and growing evidence for preserving muscle mass and cognitive function after 60. A 2021 meta-analysis in Nutrients found creatine supplementation significantly improved muscle strength in older adults. Consequently, omega-3 fatty acids from fish oil have proven benefit for triglyceride reduction at doses of 2 to 4 grams daily.
By the way, I covered other crucial details on this topic in my full video. The link is on the channel. If this helped you, subscribe, leave a like, and drop your question in the comments below.